Assalamu alaikum. I am Sidra Akil and my roll number is BP1650211 and the topic of my presentation is rational and irrational use of drug. And the drug which assigned to me is hydrochlorothiazide. Hydrochlorothiazide is used to treat high blood pressures and swelling due to fluid buildup. Fluid buildup is also known as water retention which can cause swelling in legs and hand. This drug belongs to class of diuretics, also known as water pills. It is eliminated mainly through kidneys. Its elimination half-life is 5.6 to 14.8 hours. Now the rational use. First, we can discuss appropriate indication. This drug is indicated in high blood pressures. It is also used to treat edema and it is also used to treat patients with diabetes insipidus. Now the appropriate dose. This drug is available in the form of tablet and capsules and the dosage is 12.5 mg, 25 mg and 50 mg. For hypertension, the dosage is 12.5 to 50 mg per oral once daily. And for edema, the dose is 25 to 100 mg once daily. And for diabetes insipidus, the dose is 200 mg per oral once daily. Now, we need dosing modification for renal impairment because mainly the drug is eliminated through kidneys. Creatinine clearance is a test which can tell us the renal function. If creatinine clearance of patient is less than 10 ml per minute, then the patient is not allowed to use this medication. If the creatinine clearance is greater than 10 ml per minute, then there is no need for dose adjustment. If the creatinine clearance of patient is less than 30 ml per minute, then he can use this medication with loop diuretics. Overdose management. If a patient is overdose, then we can give him normal saline for volume replacement. And if he experiences hypotension because of overdosage, then we can give him dopamine and norepinephrine. Appropriate period. Patient cannot use it for a long period of time because it may damage heart and it can also damage blood vessels, which can cause stroke, heart failure, or kidney failure. Warnings. If a patient is used this drug, hydrochlorothiazide, then he cannot use large amount of food which is high in potassiums. High risk group. This drug is not allowed and contraindicated to the people who are suffering from kidney dysfunction and the pregnant mothers. Now the irrational use. Hydrochlorothiazide causes pancreatitis because it increases calcium resorption and calcium can act as the main element for pancreatitis. This drug can also cause severe skin reactions such as Stevens-Johnson syndrome. Interactions. This drug interacts with barbiturates because barbiturates lower blood pressures and this drug also lower blood pressures, so a patient can experience hypotension. This drug also interacts with lithium. It can retain lithium in the body which can cause serious side effects. This drug also interacts with cholesterol lowering drugs. These drugs make hydrochlorothiazide less effective because hydrochlorothiazide increases cholesterol and cholesterol lowering agent decrease cholesterol. Now the brand name of this drug is Advantech, which is manufactured by Getz Pharmaceuticals and its price is 6,444. Other brand name is Bepsar Plus, which is manufactured by Nabi Qasim Industries and the price is 200. And the other brand name is Cardace H, which is manufactured by Zafar Pharmaceuticals in the price of 40. Now the alternative brand of this medicine is Restil, which is available in the form of tablet. Its dosage for adult is 2.5 to 40 mg and for pediatric it is not recommended. The other brand is Idurin, which is also a tablet and the dosage for adult is 2.5 mg per oral and for pediatric it is not recommended. The other brand is Cardiolite Plus and it is also available in the form of tablet. The dosage for adult is 0.35 to 2.85 mg per kg 2 hour per oral and for pediatric the dose is 2.5 mg per kg 2 hour per oral. Now we can study case which is related to this medication. There is a patient Mr. WS who is 65-year-old and have severe headache and past medical history of hypercholesteremia. For hypercholesteremia, he is treated with atorvastatin 20 mg. Both of his parents and several of his siblings have hypertension. He stated that he has been under stress in workplace for the last month. Patient is also a smoker and occasionally drink alcohol. Now the soap notes. First, subjective. The gender of patient is male and the age is 65 years. Patient complaint is of headache that started 2 weeks ago and sometime accompanied by dizziness. Medical history is of hypercholesteremia, and current medication is atorvastatin 20 mg, 1 tablet oral at bedtime. Objective: vital signs: temperature is 98.5 degree Fahrenheit, pulse is 87, blood pressure is 159 to 92 mmHg, which is high. Height of the patient is 6'4", and weight of the patient is 200 IB, BMI is 25, and there is no pain. General appearance of a patient is alert and oriented. Now assessment. The patient has hypertension according to the symptoms and high blood pressure, which is 159 to 92 mmHg, which is classified as stage 2. The patient is also smoker and obese. Now the plan. Pharmacological treatment. The treatment of choice in this case is thiazide-like diuretic hydrochlorothiazide tablet 25 mg orally once daily. And we also give him atorvastatin 40 mg for hypercholesterolemia. Non-pharmacological treatment. The patient is advised to lose weight and take healthy diet. Regular physical exercise is needed, and tobacco cessation is also needed. We have to educate patient regarding his disease. Provide with nutrition information that which food he has to take or not. He has to monitor daily blood pressure twice at home for 7 days. We instruct him about his medical intake. We also instruct him about his complication, which is stroke, heart attack, and other problems. Smoking cessation is counseled, and we say him to follow up in 1 month. This presentation is taken from these reference, which is Drug Information Handbook, Pharmacopedia, Pakistan. Thank you so much.